Bone disorders are a growing health concern worldwide, affecting millions of people and posing significant challenges to healthcare systems. Often dubbed silent diseases, bone disorders often progress unnoticed until a fracture occurs. This essay will delve into two prevalent bone disorders, osteoporosis and metastatic bone disease, or MBD. We will explore their causes, impact, treatment options, and the crucial role of physical activity in maintaining healthy bones. Our bones provide structural support, protect our organs, and enable movement. However, various factors can compromise bone health, leading to debilitating conditions. Osteoporosis, characterized by low bone density and increased fracture risk, is a major public health issue. Similarly, MBD, where cancer spreads to the bones, presents significant challenges in management and treatment. Understanding these conditions is crucial for early detection, effective treatment, and ultimately, improving patients' quality of life. Furthermore, promoting bone health through lifestyle interventions, particularly physical activity, is paramount in preventing or delaying the onset of these disorders. Osteoporosis, meaning porous bone, is a condition that weakens bones, making them fragile and more likely to fracture. In osteoporosis, bone mineral density and bone quality are reduced, leading to compromised bone strength. This weakening occurs silently over time, often without any symptoms until a fracture occurs, typically in the hip, spine, or wrist. Imagine a sponge. A healthy bone resembles a new, firm sponge, while an osteoporotic bone is like an old, brittle one. This loss of bone strength significantly increases the risk of fractures, even from minor falls or bumps. These fractures can cause significant pain, disability, and even death, particularly in older adults. Osteoporosis is often called a silent disease because bone loss occurs gradually and without noticeable symptoms. Many people are unaware they have osteoporosis until they experience a fracture. This highlights the importance of bone density screenings, especially for individuals at higher risk, such as postmenopausal women and older adults. Osteoporosis poses a significant global health burden, affecting over 200 million people worldwide. It is a leading cause of morbidity and mortality, particularly in the elderly population. Each year, over 9 million osteoporosis-related fractures occur globally, resulting in significant healthcare costs and reduced quality of life. Research into osteoporosis is a dynamic field, with scientists focusing on several key areas. Understanding the role of osteoblasts, the cells responsible for bone formation, is crucial in developing new therapies. Sarcopenia, the age-related loss of muscle mass, is closely linked to osteoporosis, and researchers are exploring interventions to address both conditions. Furthermore, the gut microbiota, the trillions of bacteria residing in our intestines, has emerged as a potential player in bone health. Studying the complex interplay between the gut microbiome and bone metabolism offers promising avenues for novel treatments. Additionally, denosumab, a monoclonal antibody that inhibits bone resorption, is being investigated for its long-term efficacy and safety in treating osteoporosis. Metastatic bone disease, or MBD, occurs when cancer cells from a primary tumor spread to the bones. This spread, known as metastasis, commonly affects bones in the spine, pelvis, ribs, and long bones of the arms and legs. MBD can cause severe pain, weaken bones, increase fracture risk, and significantly impact a person's quality of life. The presence of cancer cells in the bone disrupts the normal balance of bone formation and resorption. This disruption weakens the bone from within, making it more susceptible to fractures. These fractures can be extremely painful and debilitating, often requiring surgery and prolonged rehabilitation. MBD can also cause other complications, including hypercalcemia, a condition where calcium levels in the blood become dangerously high. Additionally, compression of the spinal cord can occur if tumors grow in the vertebrae, leading to neurological problems. Managing MBD requires a multidisciplinary approach, addressing both the cancer itself and the skeletal complications it causes. Section 5. The economic burden of metastatic bone disease. Metastatic bone disease represents a substantial economic burden globally, impacting healthcare systems, patients, and their families. The global market for MBD treatments was valued at $19.6 billion in 2023 and is projected to reach $30.8 billion by 2030, reflecting the increasing prevalence of cancer and the need for effective therapies. This growth is driven by several factors, including the rising incidence of cancer worldwide, particularly in aging populations. As cancer treatments improve and life expectancy increases, more people are living with cancer, increasing the likelihood of developing MBD. Furthermore, advancements in bone-targeted therapies, which specifically target cancer cells in the bones, are driving market growth. The cost of managing MBD includes hospitalizations, surgeries, medications, imaging tests, and palliative care. The economic burden extends beyond direct medical costs, encompassing lost productivity, informal caregiving by family members, and the emotional toll on patients and their loved ones. Section 6. Advancements in bone-targeted therapies for MBD. Significant progress has been made in developing effective therapies for MBD, aiming to relieve pain, prevent fractures, and improve patients' quality of life. Bone-targeted therapies, which specifically target cancer cells in the bone, play a crucial role in managing this complex condition. Radiopharmaceuticals, a type of radiation therapy, deliver targeted radiation to bone lesions, effectively killing cancer cells and relieving pain. Bisphosphonates, another class of drugs, slow down bone resorption, reducing fracture risk and strengthening bones weakened by cancer. These therapies have significantly improved the management of MBD, providing patients with more effective pain relief and a better quality of life. Ongoing research continues to refine existing treatments and explore novel therapeutic approaches. Clinical trials are investigating new radiopharmaceuticals with improved targeting and reduced side effects. Furthermore, researchers are exploring the potential of immunotherapy, which harnesses the body's immune system to fight cancer cells in treating MBD. Section 7. Physical activity, a cornerstone of bone health. Maintaining strong, healthy bones throughout life is crucial for overall health and well-being. While several factors influence bone health, including genetics and nutrition, physical activity plays a pivotal role, particularly during childhood and adolescence, when bones are still growing and developing. Weight-bearing exercises, such as running, jumping, and dancing, are particularly beneficial for bone health. These activities stress the bones, stimulating them to become denser and stronger. Engaging in regular physical activity during childhood and adolescence helps build peak bone mass, which is the maximum bone density achieved in early adulthood. Furthermore, physical activity offers numerous benefits beyond bone health. It improves cardiovascular health, strengthens muscles, helps maintain a healthy weight, and enhances mental well-being. Encouraging children and adolescents to adopt an active lifestyle is an investment in their present and future health. Section 8. The global inactivity crisis and its economic impact. Despite the well-established benefits of physical activity, a global inactivity crisis threatens public health and places a significant strain on healthcare systems. According to the World Health Organization, 31% of adults and a staggering 80% of adolescents globally do not meet the recommended physical activity levels. This widespread inactivity has dire consequences. It increases the risk of chronic diseases, including heart disease, stroke, type 2 diabetes, certain cancers, and osteoporosis. The economic burden of physical inactivity is substantial, costing public healthcare systems an estimated $300 billion between 2020 and 2030. Addressing this crisis requires a multi-sectoral approach involving governments, healthcare providers, educators, and communities. Promoting physical activity should be integrated into various settings, including schools, workplaces, and communities. Creating safe and accessible spaces for physical activity is essential, as are public awareness campaigns highlighting the benefits of an active lifestyle. Section 9. Protecting our skeletons, a call to action. Bone disorders pose a significant threat to global health, affecting millions of people and placing a substantial burden on healthcare systems. Understanding the causes, risk factors, and available treatments for conditions like osteoporosis and MBD is crucial for effective management and improving patients' lives. Promoting bone health through lifestyle interventions, particularly regular physical activity, is paramount in preventing or delaying the onset of bone disorders. Addressing the global inactivity crisis requires a concerted effort from all sectors of society. Investing in initiatives that encourage and facilitate physical activity is an investment in a healthier future. By raising awareness about bone health, supporting research efforts, and promoting healthy lifestyles, we can mitigate the impact of bone disorders and ensure stronger skeletons for generations to come. Let us prioritize bone health as an integral part of overall well-being and work together to build a world where everyone can enjoy strong, healthy bones throughout their lives.